Hey everybody, Dr. John here. Today we're going to discuss brain injury and recovery after brain injury. Please subscribe to get more of these videos and reach out to me on Instagram or comment in the section below. The brain is responsible for basically everything that we do. Our speech, hearing, vision, motor activity all rely on our brain. Damage to our brain can affect any aspect of our lives. We are all unique in our own ways, and our brains are no different in that regard. Each brain injury, and subsequently, each injured brain is truly unique. Our bodies were designed to protect our brains. The skull is a protective shell. The brain floats in fluid, which helps to stabilize it as well as to provide vital nutrients. With a great enough blow to the head and subsequently to the brain, these protective mechanisms break down. During a traumatic event, the brain pushes against the skull and is bruised. Based on the angle of impact and rotational components, the brain twists and turns, tearing blood vessels and axons of nerves. Recent advances in neuroscience and brain injury rehabilitation medicine have shown that the brain has a great capacity to at least try and repair itself. Neuroplasticity is the brain's ability to develop new neural connections and pathways. The brain reorganizes itself and undergoes new structural and physiologic changes. Unfortunately, there is some damage that may never recover fully. The brain does have areas of redundancies, and some areas can take over to help out in new tasks. Not all damaged brain tissue regenerates. Fortunately, parts of the brain that were not damaged will continue to function well. Some components of the brain that were damaged will heal entirely, some to an extent, and some not at all. After injury, the things you knew really well are best preserved. The things we learned a long time ago have a greater chance of remaining viable. Newer learned content is a little bit more challenging. We do have an age paradox. Younger brains heal better, their neuroplasticity and redundancy is stronger. However, the younger brain has less material that was stored a long time ago, and thus there's less to fall back upon. Older brains, on the other hand, have older, more deeply stored information and memories. They just don't heal as well. There is essentially a trade-off between younger healing brains and older brains with deeply stored information. After brain injury, function that does not return, the goal is to try and work around it. Every brain is different, and generally, soft tissue heals more slowly than hard tissue. The brain is not like bone, which heals quickly. The brain takes a while to heal. As a general way of thinking about it, there are 3-month blocks to recovery. After 3 months, if there remains a severe deficit, you will likely have some degree of deficit over the long term. If a bad deficit remains at 6 months, there will probably be some challenge there over the long term, but some degree can recover. After 1 year, deficits will have subtle improvement. Overall, the brain heals faster in the beginning, and then the rate of healing slows down. Recovering from a brain injury is extremely hard work, and those going through it, as well as the support systems around them, deserve all the praise in the world for doing what they are doing and working as hard as they are working. This was just an overview. Brain neuroplasticity and recovery needs a lot more time than what can be accomplished in just a few minutes. Stay tuned for a deeper discussion in our next video. Thanks for watching. Subscribe for more great content like this, and if you found this information valuable, please share.